Hi everyone, today we'll study anesthesia section from CPT. It is a small section but there are key concepts which we need to know for coding anesthesia services. Let's begin. So what is anesthesia? Anesthesia is a drug that prevents patients from feeling pain or dramatically reduces pain during surgery. So there are three primary types of anesthesia: general anesthesia, regional anesthesia and monitored anesthesia care. So general anesthesia is drug-induced loss of consciousness. Regional anesthesia is loss of sensation in a region of the body using techniques such as spinal anesthesia, epidural anesthesia, nerve block or local nerve block. Then third type is monitored anesthesia care. Anesthesia service where the patient is under light sedation or no sedation while undergoing surgery with local anesthesia provided by the surgeon. The patient can respond to the purposeful stimulation and can maintain his airway. So, this service is monitored by anesthesia provider who is prepared at all times to convert monitored anesthesia care to general anesthesia if necessary. Now let us go through the anesthesia code range. Anesthesia codes are grouped anatomically beginning with the head. You can see we have codes for head, neck, thorax, intrathoracic, spine, upper abdomen, lower abdomen, perineum, pelvis, upper leg, knee, lower leg, shoulder and axilla, upper arm, forearm, radiological purposes, burn excision, obstetric and other procedures. You can see we have the codes for anesthesia services performed on head, neck. Likewise, we have codes for different anatomical regions. In anesthesia services for upper abdomen, we can find they have mentioned anesthesia for intraperitoneal procedures, and also for anesthesia services in the lower abdomen, we can find anesthesia for intraperitoneal procedures, anesthesia for extraperitoneal procedures. So, to code these extraperitoneal, intraperitoneal procedures, we need to know what are the intraperitoneal and extraperitoneal organs. Please take a note of this. Let us start with intraperitoneal organs. So, they are located within the peritoneal cavity. Intraperitoneal organs in the upper abdomen include stomach, liver, gallbladder, spleen, jejunum, ascending colon and transverse colon. And intraperitoneal organs in the lower abdomen include appendix, cecum, ileum and sigmoid colon. Next is extraperitoneal or retroperitoneal organs. So, it indicates organs outside or behind the peritoneum or peritoneal cavity. Extraperitoneal organs of the upper abdomen are kidneys, adrenal glands and lower esophagus. And extraperitoneal organs in the lower abdomen include ureters and urinary bladder. So this is important. Now let us study the guidelines for coding anesthesia services. In your CPT book, page number 64, you can find anesthesia guidelines. Services involving administration of anesthesia are reported by the use of anesthesia 5-digit procedure codes, that is 001002 01999 plus modifier codes defined under anesthesia modifiers later in these guidelines. In the second paragraph, they have mentioned inclusive and exclusive procedures. So, included procedures we should not code along with anesthesia, and excluded procedures we have to code along with anesthesia if performed. So, here it is given. These services include the usual pre-operative and post-operative visits, anesthesia care during the procedure, administration of fluids or blood, the usual monitoring services, ECG, temperature, blood pressure, oximetry, capnography and mass spectrometry. So, all these are included services and we should not code these services along with anesthesia. Remember that. Next are the services not included in anesthesia, that is unusual forms of monitoring, example intra-arterial, central venous and Swan-Ganz are not included. So in the multiple choice questions, they may ask which services are included, which services are not included. You can refer this paragraph and answer the question. Next guideline is to report moderate conscious sedation provided by a physician also performing the service for which conscious sedation is being provided. See codes 99151, 99152 and 99153. The important guideline is time reporting. Anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room or in an equivalent area, and it ends when the anesthesiologist is no longer in personal attendance, that is, when the patient may be safely placed under post-operative supervision. So, this is how you calculate the anesthesia time. You have to check the time when the anesthesiologist begins to prepare the patient, and it ends when the anesthesiologist is no longer in personal attendance and the patient may be safely placed under post-operative supervision. An important thing is, it is not enough if we know how to calculate time. We must also know how to convert it into units. So, remember that 1 unit is equal to 15 minutes. Take a note of this. Now let us study anesthesia modifiers. In anesthesia, we have physical status modifiers. It is present in your CPT book, page number 65. So, physical status modifiers are represented by the initial letter P, followed by a single digit from 1 to 6 as defined in the following list. So, P1 is for a normal healthy patient. P2 is for a patient with mild systemic disease. P3 is for a patient with severe systemic disease. P4 is for a patient with severe systemic disease that is a constant threat to life. While coding, you have to check for all this. If the patient is having severe systemic disease, you have to append the physical status modifier P3. If the patient is healthy patient, then the modifier P1 is appended. And physical status modifier P5 is for a moribund patient who is not expected to survive without the operation. And P6 is for a declared brain dead patient whose organs are being removed for donor purposes. Next, we have qualifying circumstances. More than one qualifying circumstance may be selected. So, these are the add-on codes which has to be used only with anesthesia service. Add-on code 99100 is for anesthesia for patient of extreme age, that is younger than 1 year and older than 70. This code you have to list separately in addition to the code for primary anesthesia procedure. Next, 99116 for anesthesia complicated by utilization of total body hypothermia. Then 99135 for anesthesia complicated by utilization of controlled hypotension. And 99140 for anesthesia complicated by emergency condition. I repeat, all these qualifying circumstances codes you have to use only with anesthesia services. Here they have given definition of an emergency. In your CPC exam, the question may be asked, that is how emergency is defined. So you will find the answer here. That is, an emergency is defined as existing when delay in the treatment of the patient would lead to significant increase in the threat to life or body part. Highlight this. Here are some more important guidelines for anesthesia section. That is, if anesthesia is given by the surgeon, then append modifier 47 to the surgery code. And remember that we should never append modifier 47 with anesthesia codes. Modifier 47 should be only appended to the surgery codes. Third guideline, we should not code E&M codes with anesthesia codes. Next guideline is use of modifier 23, which is for unusual anesthesia. So, occasionally a procedure which usually requires either no anesthesia or local anesthesia, but because of unusual circumstances, it must be done under general anesthesia. Under that circumstance, the modifier 23 should be appended. There are other modifiers also used with anesthesia services, which is present in your HCPCS Level 2 manual. So, the modifier AA is for anesthesia services performed personally by anesthesiologist. Modifier AD is for medical supervision by a physician, more than 4 concurrent anesthesia procedures. Modifier GC is for This service has been performed in part by a resident under the direction of a teaching physician, and modifier QK is for medical direction of 2, 3 or 4 concurrent anesthesia procedures involving qualified individuals. Modifier QX is for qualified non-physician anesthetist, that is CRNA, with medical direction by a physician. So QX is for CRNA service with medical direction by physician. Modifier QY is for medical direction of one qualified non-physician anesthetist by an anesthesiologist, that is medical direction of one CRNA by an anesthesiologist, that is modifier QY. Next, modifier QZ is for CRNA service without medical direction by a physician. All these modifiers are present in your HCPCS Level 2 manual. Now let us solve some practice questions related to anesthesia section. First question, what are the 3 classifications of anesthesia? The right answer will be option B, general, regional and monitored anesthesia care. We studied this at the beginning of this video. That is, 3 primary types of anesthesia is general, regional and monitored anesthesia care, that is MAC. Read the question. Mrs. Sarah is a 90-year-old female having laparoscopic surgery on her gallbladder. Dr. John, the anesthesiologist for this case, documents she is a normal healthy person and begins to prepare the patient for surgery at 7:30 a.m. Surgery begins at 8 a.m. The surgery is concluded at 9:30 a.m. The anesthesiologist releases the patient to the PACU nurses at 9:45 a.m. How many minutes of anesthesia time transpired and what is the appropriate anesthesia code? So, in this question, they are asking about anesthesia time reporting. We studied in the guideline that anesthesia time begins when the anesthesiologist begins to prepare the patient for surgery. That is, in this case, it is 7:30 a.m. And according to the guideline, the anesthesia time ends when the anesthesiologist is no longer in personal attendance. That is when the patient may be safely placed under post-operative supervision. So here, the anesthesiologist released the patient to PACU nurses at 9:45 a.m. So the anesthesia time will be from 7:30 a.m. to 9:45 a.m. So calculate the time. So the time will be 2 hours and 15 minutes, which is present in option B. So option B is the right answer. You can also check the anesthesia code 00790, which is for anesthesia for intraperitoneal procedures in upper abdomen. So here the patient is having laparoscopic surgery on her gallbladder. So gallbladder is intraperitoneal organ present in upper abdomen. So is the right code. They have appended physical status modifier P1 for a normal healthy patient. You can read the scenario. She is a normal healthy person. So modifier P1, and you can see the code 99100. As we discussed, it is the qualifying circumstances code that is for anesthesia for patient of extreme age. So here the patient is 90-year-old, that is older than 70. So we have to use 99100. So option B is the right answer. The other options are eliminated because the time is wrong, and also the anesthesia code 00840, it is for anesthesia for intraperitoneal procedures in lower abdomen. But according to the scenario, the anesthesia was for the intraperitoneal procedure in upper abdomen. And code 00700 is for anesthesia procedures on upper anterior abdominal wall. So that is also wrong. So we eliminated A, C and D. Option B is the right answer. Next question. This question is also related to time reporting. A pre-anesthesia assessment was performed and signed at 10:21 am. Anesthesia start time is reported as 12:26 pm and the surgery began at 12:37 pm. The surgery finished at 5:12 pm and the patient was turned over to PACU at 15:26 pm, which was reported as the ending anesthesia time. What is the anesthesia time reported? So, this is a straightforward question. They have mentioned the anesthesia start time 12:26 pm and the ending anesthesia time is 15:26 26. So the right answer will be option B. Don't get confused with the pre-anesthesia assessment time. Stick to the guideline that anesthesia time begins when the anesthesiologist begins to prepare the patient for induction of anesthesia, and it ends when anesthesiologist is no longer in personal attendance, that is when patient is safely placed under post-operative supervision. Next question. Mr. Charles, age 83, having been in poor health with diabetes and associated peripheral neuropathy, is having a FEM-POP bypass. The anesthesiologist documents he has severe systemic disease. Choose the correct anesthesia code. You can see several codes in the options, and they have also mentioned physical status modifier P2 and P3. So to reach the right answer first check the physical status modifier. P2 is for patient with mild systemic disease and P3 is for patient with severe systemic disease. Now read the scenario. The anesthesiologist documents that the patient has severe systemic disease. So we have to use the physical status modifier P3. Directly eliminate the option which has P2. So we'll eliminate option A and option C. Now we are left with option B and option D. Check the code 01272 and 01270. 01270 is for anesthesia for procedures involving arteries of upper leg, including bypass graft. In this scenario, they have mentioned the patient is having a femoropopliteal bypass. So it is matching with the code 01270, which is for anesthesia for procedures involving arteries of upper leg, including bypass graft. So 01270 is the right code. Option D will be the right answer. 01272 is wrong because that is for femoral artery ligation. But we have to code for femoropopliteal bypass, that is 01270. So we'll eliminate option B. In option D, they have mentioned the code 99100, which is for qualifying circumstance that the age of the patient is 83 years. If the age of the patient is older than 70, we have to use the add-on code 99100. So option D is the right answer.